Hi, it's wonderful to see you again. You're looking very well. How have you been since the last time I saw you? Wow, that's wonderful to hear. So, annual physical exam. You're a little bit early, if I remember right. I know, where has the year gone? But it's always good to see you, and I look forward to you coming in every year. So, we'll jump right in, shall we? You must be so familiar with the procedure by now that you could probably do a physical exam on me, right? I know. So, let me just get you to confirm your name and date of birth. Make sure we've got the right person. Oh, you'd be surprised. There are lots of people with similar names, well, the same name, and the same birth date. So it gets quite complicated. And do you consent to me carrying out this physical examination on you today? Perfect. So, any changes to your lifestyle? Any changes to alcohol or tobacco consumption? Changes to your diet? Any changes to medical history? Family medical history, I should say. What about any surgeries in the last year? Coughs, colds, aches or sprains? What about any changes to supplements, medications, that sort of thing? Alright, and any surgeries? Did I ask you that already? Okay, perfect. So nothing has changed since your last visit. Well, that's perfect. That's exactly what we want to hear. Whatever you're doing, health and lifestyle wise, keep doing it. It's clearly evident in your radiant complexion and the health just radiating from you. Alright, so if I could get you to take a nice deep breath in and out, in through your nose and out through your mouth. Good. This is just to relax your body and your heart rate for the heart portion of the examination. It's a common phenomena that people get quite nervous when they come into the doctor's office, and their heart rate can get quite fast. So we just want to slow it down so we can get an accurate reading. Do you feel nice and relaxed? Good. So you can close your eyes if you would like, or keep them open. And I'm going to listen to your heart. You don't have to do anything. Just take some nice deep breaths in and out if you feel like it. Alright. Here we go. Very good. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Alright. So your heart seems to be perfectly healthy. I'm very happy. Now, your lungs. Just breathe normally, and then I'll instruct you when to take deep breaths in, hold that breath, and then breathe out. All right? Breathe in, breathe out. Good. Breathe normally. Good. Breathe in, breathe out. Good. Breathe in, breathe out. Good. Breathe normally. Good. Breathe in, hold. Breathe out. Breathe in, hold. Breathe out. Okay. So your lungs are perfectly clear, perfectly healthy. So that's really, really good. So, did you just want to pop on those scales over there? I just need to take your weight. Okay, that just links up to my system here. Okay. That's perfect. Well done. Yes, of course. Now I just need to take some measurements. I just need to take your waist measurement. If you just sit up, you don't need to get up, that's absolutely fine. Okay, that's perfect. I believe you may have lost a little bit of weight. That would make sense. Okay. So, if I could get you now to just put your hands out in front of me, I'm just going to see the colour of your skin and your nails. Okay, it's good. Perfect. Just get a flashlight. Okay. Good. And I'm just going to check your hair now. Just having a look on the scalp. Okay. Good. Any problems with any dandruff? Okay, that's good. Alright, great. Have you experienced any dryness, sensitivity, or itchiness anywhere else on your skin? Right, I see. Well, that makes total sense, and it's a good job that you identified it before it could develop into anything else. You're very intuitive. Alright, so now just look at my nose. I'm just going to flash this light into your eyes. Just swing it backwards and forwards. Shouldn't be too uncomfortable. I'm just going to see the pupil reaction here. Okay, good. 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 Alright, that's great. Pupil dilation is perfect. Now I'm going to just place the light in your eye, and I'll just instruct you to look in various directions. Okay. So if you can just look up. Good. Look down. Good. Look to your left. And look to your right. Perfect. Now what I would like you to do is, while staring at the center of my nose, I want you to follow the light with just your eyes. Okay. Good. 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 That is perfect. So a little bit of peripheral vision now. Stare at my nose, and I want you to tell me, well, point to the fingers that are wiggling. So if I were to do this, that's right. Here we go. Good. 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 Alright, that's really good. Now, this finger, I just want you to tell me when it moves out of your vision. Good. Just tell me when it can't see it anymore. Good. 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 That's really good. Well done. Very, very strong peripheral vision. So now, whilst we're this side of your face, I'm just going to take a little look inside your mouth, if that's okay. I'm not going to do anything intrusive. I'll leave that to your dentist. But if you could just open your mouth and give me a nice big okay. Alright. And stick your tongue out. Okay. Alright. Good. Okay. And now just tilt your head back slightly. I'm just gonna check your nose. Okay. Okay. Does it get sore a little bit? Just try. No, that's absolutely fine. This time of the year it can be hell with allergies. So we're blowing our noses more, and there's a lot of external irritants around. But I would suggest, if it's bothering you, to get a nasal solution, just a once a day little squirty thing. And make sure that you're using extra soft tissues with a little bit of balm in them. A little goes a long way when you're blowing your nose an awful lot. Just don't use kitchen paper because that stuff can be so rough on your nose. Okay, so we can just take a little break while I just prepare my otoscope. We're going to be looking at your ears. So, any changes to your hearing in the last 12 months? Well, that's good to hear. Oops. Let's just put that back on here. Yeah, that'll do it. So, you said that you go to the hearing clinic once a year? Sure. No, I totally understand. That's a very wise measure. If you're working in a loud environment, then to have your hearing tested on a yearly basis rather than never, like we do, is actually very good because you can catch hearing loss early or help prevent it in some way. You use earplugs, right? Good, you're the model patient. Alright, so just tilt your head to one side. I'm just going to have a look inside this ear here. Alright, good, perfect. And this ear here, let me just take a little look. Alright, so surprise, surprise, your ears are perfectly clean. There is literally no earwax and they look lovely and pink and healthy. The eardrum is lovely and white and clear. It's, well, perfect ears. Perfect. So just a little bit of a hearing test now. I'm going to be using the tuning fork, on the forehead and on the back of the ear. And I want you to first of all let me know if it sounds equal on both sides. Then if we ring it again, I just want you to let me know when it stops ringing. Does that make sense? Alright, here we go. Alright, does that kind of sound equal on both sides? Good. And now behind the ear. Does that kind of sound equal? Okay. Okay, good. Okay, now when I ring it, I want you to tell me when it stops ringing, or when you hear the ringing stop, I should say. Okay, just let me know when the ringing stops. You still hear it? Amazing. About there. Okay, that was really good. Now behind the ear. Just let me know when you hear it stop ringing. My hearing is very good. About there. Okay. And on this ear. About there. Okay, perfect. Alright, so we won't do a whisper test because I believe you're due for your cranial nerve exam soon, and we go into depth about that. We go into depth on that in the cranial nerve exam, so we can omit that today if you're running out of time. Sure, alright, that's fine. When are you booked in? Oh, so that's not very long at all. Fine. Then you'll be perfectly fine to omit that today. So, if you could just relax your face, I'm just going to test the jaw, the muscles in your jaw. I'm getting my words back to front today. So, I would just look at you here. Could you just open your mouth? I'm going to place my hand under your chin and just try and resist me. That's good, perfect. Now keep your jaw open, and I'm going to try and close your jaw. Just try and resist me. That's perfect. Any pain in the jaw here? Just by the ears. Okay, that's fine. Now, if you could just scrunch your face up. We'll do this in the cranial nerve exam, don't worry. And relax. Alright, let me just feel your neck for thyroid. Okay. Okay, good. Alright, perfect. Everything seems to be good. And let me just press on your tummy a little bit. Just have a feel there? Good. Alright. Okay, no pain or discomfort. Good. Okay. And now if you can just squeeze your hands and release any pain or discomfort there. And now just take my hand and squeeze. That's good. And release any pain or discomfort. Right, perfect. So that brings us to the end of your annual physical exam for 2024. I'll go ahead and order you some blood work to be done. You can book that at the reception, as always. And that'll give us a good indication what's going on inside for this year. And I guess that I will see you very soon for your annual cranial nerve exam. That's right. I'll go into a little bit more depth of the cranial nerves and all that lovely stuff that I know you love. Alright. Yes, of course. I think bookings are going to be open for next year, the end of this week. Because you're slightly early, we haven't opened our booking system for the next 12 months yet. We're still in the old year. I know, it's very backwards. But when you come in to see me for your cranial nerve exam, you can book 2025's annual physical exam then. Perfect. Well, it's been a pleasure as always to see you, and I'll see you in a few weeks' time. Take care.